Wonderful. Well, welcome everybody. This is the webinar on partnering with WomenHeart, and we're very pleased to have you here with us today. Next slide. So I'm Selena Gore. I'm the CEO here at WomenHeart, and we're so happy to have you with us today. We know that hospitals are doing an incredible amount of work every day to care for patients and to care for heart disease patients. But we also know that women with heart disease face some incredibly huge challenges, unique challenges, being misdiagnosed, being undertreated, feeling isolated in their experiences, and just in general having a rough go of it. So today we'll share how Women Heart and our trained Women Heart champions can help you take your patient-centered care to the next level by ensuring that women feel seen, heard, and supported through their heart journeys. We're here to introduce you to the organization called Women Heart and also to our National Hospital Alliance program. You'll learn who we are, how our champions support women living with heart disease, what a partnership with us looks like, and how hospitals across the country are already benefiting from this collaboration. And you'll also hear directly from our champions, a woman living with heart disease who has helped so many people in her community, and is helping hospitals to deliver care that is not just clinically sound, but also human-centered, focusing on that human connection that is so needed when going through a heart disease diagnosis. Women Heart is the only national organization dedicated solely to women with heart disease. Our work is focused on three areas: peer-led networks, providing support where women can connect with each other who understand what they're going through; education, delivering accurate, timely resources for women with heart disease or at risk of heart disease, and the communities around them, while also providing our hospital partners with patient-centered tools that reflect what women need to know in order to feel empowered in their diagnostic journey and their care. And also, we provide advocacy, ensuring that women's voices are heard in the clinical setting and research, and importantly, in policymaking. Importantly as well, equity is at the core of everything we do. Because we know women of color in particular and women in rural settings are left behind way too often. So we do what we can to center our community around closing those gaps. And I'm going to hand it over to Jody.
Hello, I am so excited to be here today. I am the Director of Strategic Alliances, and I'm honored to get to talk about this wonderful program and our amazing Women Heart Champions. So a little bit about what we do here at Women Heart. We, as Selena was talking about, we provide peer support all across the nation and in our local communities. So we have peer support networks in the communities, and these networks are led by trained Women Heart Champions. They are like support groups who work in their communities and with their National Hospital Alliance members as well. We also educate. We provide trusted tools and webinars and trainings, and these are all designed to empower women so that who are living with heart disease or at risk of heart disease, so they can get a diagnosis, they can get treated to evidence-based care, they can get the support they need, and they can have access to the resources they need. We also advocate for many different policy issues and many different initiatives that help increase women's representation in clinical trials. And we also participate in clinical trials as advisors, and we advocate for health systems and health policy to improve the lives of women living with heart disease. And we, as Selena was just saying, advancing equity is central to everything we do. We believe that all women deserve access to care, quality care that they can afford. And so we work to ensure that that happens. And in terms of our reach and impact, so our program is, we are small in staff number, but we are large in reach and impact. With our Women Heart Champion program, this is an amazing program with 1,200 to date trained Women Heart Champions, and that training has been available since 2002. Many of the champions stay active well after the training, and they have worked with Women Heart, and we have over 40 Women Heart support networks, and that includes virtual and in person. So you will see see some of the support networks meet in person in communities, and some of them meet online, and then some of them are also hybrid. So the Women Heart support, the champion support trickles down into communities. And so for each champion, we reach thousands of other women. And so you see 27,000 women reached in 2024. And this is a result of the work, the partnership between the Women Heart Champions and the National Hospital Alliance. And as you can imagine, 27,000 makes a huge difference in the lives of many women and their families. One of the things we have is our red bags of courage, and I have show and tell because I believe in show and tell. And our red bags of courage are full of information for women and others who that is about heart disease. It's about prevention. It's about getting the care you need. It's about connecting you with Women Heart resources. And we give over 20,000 of these bags out. And some of them are given directly to women in the hospital, but they're given out in health fairs and other conferences and all sorts of wonderful places. We also have champions in 46 states. Now, don't ask me what the 4 states are where we don't, because I will not be able to answer you, but I know who can, and I can get the answer. So, but how exciting is that? So, who are the Women Heart Champions? And if you've never met a Women Heart Champion, they are the most amazing people because they have had experiences, some of them you just can't even believe, with heart disease, trying to get a diagnosis, trying to get the treatment they need, getting the care they need. But these are women who are living with heart disease who decided not just to moan and complain about it, but do something with it. They decided to give back and help others, and um, they use their experience to help provide support and education for others and to advocate for improved heart care for women. Women Heart Champions go to a training. We call it Science and Leadership, or SNL for short, and this is in partnership with the Mayo Clinic in Rochester. This training trains them in health equity, in basics of heart disease in women. We have a professional come in and talk about how to tell your story and share your story for impact, advocacy, and all the things they need to come back to their communities and support and educate their communities in their areas. So they are equipped to, of course, provide support and host educational events, but they also do all sorts of things in community outreach. So when our hospitals, our National Hospital Alliance members have a health fair, or they have something where they want to raise disease awareness, we participate in a lot of awareness days, like Valve Disease Awareness Day. And the Women Heart Champions can participate in that and help create that awareness and talk to people, have a table, do a presentation, anything where they engage with their communities. And so you'll see them out at many different things, spreading the word and raising awareness. They also are incredible at sharing their stories. Now, a lot of people can share their story about heart disease, but not the way Women Heart Champions can. They are trained by a national professional who we get to come in, and they are able to tell their stories in a very concise, powerful, an impactful way that you don't see with many. I call them expert patients because they just are so good at this. And they are in demand, high in demand. All sorts of people want a Women Heart Champion to come and share their story. And when they work with the National Hospital Alliance members, they can share their story in different ways as advisors, as people sitting on panels, as presenters, co-presenters with healthcare professionals, all sorts of ways that they can enhance what the hospital is doing. And so obviously they collaborate with the hospitals and health professionals on that. Um, and so, how do champions impact hospitals? Well, we talked about this a little bit, but really, Women Heart Champions, and my one of my favorite Women Heart Champions, I love them all though, is going to be here later talking. They do programs where they work with the hospitals. She also is working with cardiac rehab centers and other clinics, and they work with the hospital to help improve care for women. So they enhance patient support. And one of the things about patient support, a lot of people don't realize unless you've been there, that healthcare professionals are great and they can fix your heart and they can help you get better and healthier. Your family and friends are great because they can be a support, but there is absolutely nothing like someone who's been there, who's been through this experience and knows what it's like to walk in this journey. And can make a huge difference in the not only physical health, but the mental health, and also with medication adherence, with adherence to treatment plans. It has a huge impact overall, and it's not just a nice thing to do, but it's actually one of the healing modalities. We also provide peer support after diagnosis to foster connection. So again, that understanding someone, really knowing, having that empathy and understanding and all the good results that leads to. And then they develop a network and they have a community and they don't feel so alone, which is important to all of us. They help increase community engagement and build trust beyond the clinical setting. So not only do they connect with each other, but then they go out and do all sorts of things in their communities. And a lot of them are really amazing in terms of helping their communities get more educated and aware of heart disease, and especially things like heart attack symptoms in women, which may be different than those in men. And they elevate the patient voice to help inform the hospital practices and improve care. And so our Women Heart Champions can bring in that voice of someone with lived experience, and other people can guess what that's like, but they know what it's like and can bring that into discussions where it can drive positive changes. So what is the National Hospital Alliance? Well, our National Hospital Alliance is a network of hospitals who are committed to women's heart health. And they have partnered with Women Heart to try to continue to improve women's heart health and the care and support of women. They want to focus on peer support, patient education, and advancing equitable gender-specific care. And that we do many things with them. We share information, campaigns, and all sorts of things with our Hospital Alliance members so that we can do this together. So the benefits, aside from just really working with us to advance women's heart health, we also help hospitals identify a trained women heart champion or a bunch of trained women heart champions for to provide that patient support in their hospital and those community programs. We the hospital can help identify, but we have tools that they can use to identify these women heart champions that would then go to the science and leadership training, which by the way is both there's a virtual version and an online in-person version. So if you can't be there in person, you can excuse me, also do it online. We give the hospitals and healthcare entities we work with access to so many educational tools, community engagement resource, our red bags of courage, which are coveted. You know, these red bags are coveted. So we give them access to that. And when we have a new campaign or new resources coming out, like recently, we came out with our Enact, which is a clinical trial program, and we have all these really wonderful resources on clinical trials to help women and all people get engaged in a clinical trial and participate in clinical trials. So we shared that with all our National Hospital Alliance members. They also get visibility as a leader in women's cardiovascular care. So we have the listing of National Hospital Alliance members on our website, but we also work with the different hospitals on different programs. Again, going back to Valve Disease Day, we worked with two different hospitals on valve disease awareness events that were nationally publicized. And so you get that kind of visibility. And then you get ongoing support from Women Heart's team. So we have staff people that are here to help and help with the champions. And so you get that ongoing support from our staff. So now I have the honor to introduce a WomenHeart champion who's incredible. And I really just have enjoyed meeting her and working with her. And it's Kathy Porter. And Kathy is a woman living with heart disease who, like the other WomenHeart champions, turned her diagnosis into a mission. She decided she was going to support other women, share her story, work alongside hospitals, and ensure patients are seen, supported, and empowered. Kathy became a WomenHeart champion in 2004. So she's been one of our lovely WomenHeart champions for many years. Kathy, we are absolutely grateful that you're here today to talk more about your experience, but not just as a patient, but someone who is providing support to the women in your community and working to engage the hospitals that you work with to create more compassionate and patient-centered care. So I first want to thank you for being here and then open it up for you to share a little bit about your story.
Thanks, Jody, so much. A little bit about my story. I actually had a massive heart attack the day before my 45th birthday. I was monitored very closely after that. And 5 years after my heart attack, my cardiologist said, I need you to talk to a surgeon. So 5 years later, I had a left ventricular aneurysm resection off my left ventricle. And when I was in the hospital, I was visited by a male volunteer. I wasn't sick. I didn't have any symptoms or anything like that. I was in there to have this aneurysm removed. So when the volunteer came in to visit with me, it was very short. He told me I really didn't look like I needed any support. And he said, but if I have questions, just let him know. And so I knew from that point forward that when this was all over, I wanted to come back as a volunteer. And my cardiologist gave me a brochure on WomenHeart. And that's how I got started.
Well, it's amazing how when you either get and have an experience like that where you're visited and it goes bad, or you're visited and you're like, oh, I want to do that too. That really is motivational to become a WomenHeart champion. What other things were motivating you at the time when you got that brochure? What other things were really appealing or attractive to you to become a WomenHeart champion?
So to be honest, I really didn't know what I was getting into. It was going to be my training so that I could come back and go through volunteer training and then become a volunteer in the hospital so I could go talk to patients either before or after their procedures. And I did that for a while. But while I was at WomenHeart, I learned about support groups and I learned about health fairs and just a variety of other things, advocacy that we can do in the community to be involved. And so that's what I did here in Kansas City. We started the support group. I'll be honest, it took a year and a half for that support group to take off. The key is patience and not to give up, to just stay with it. And now our support group has been going for 20 years. This is our 20th anniversary. And and it's been a blessing for many, many reasons. But and another thing is through our support group, we have reached out to cardiac rehabs across Kansas City, and they support us. They pass out our information. They let women know, and that's how the women come to us for our support group meeting, is basically through our cardiac rehab programs here in the Kansas City area. We look for speakers, um, different healthcare professionals. And what I can say about that is that women in our group have, because of WomenHeart, women in the group have learned so much more than just their diagnosis. They understand it. They understand what may be coming next. They're able to sit there as their cardiologist speaks to them and at least understand most of what they're saying to them, so they're not left in the dark. Um, it's been a great education for the women in our support group in our area.
How else do you feel going, you know, with the better understanding and the education, but what other things do you feel like the women benefit from when they are connected with your network?
I truly believe there are better outcomes for women once they have been put in touch with someone from WomenHeart. It's someone to hear their story, whether it's on the phone or coffee or lunch or at the support group meeting. It is someone to listen to them because they haven't had that in the past. They learn all about different types of heart diseases. And so they are not quite as scared of even such terms as heart failure, because they see other women in the group living with heart failure and living a good normal life. It's a new normal, but it's a good life, and that it just shows them that they can go on and that this isn't a death sentence.
Yeah. I think, like you said, when people don't feel so alone or like they're the only ones going through something, it makes a big impact. Can you tell
Right.
us a little bit about how you partner with healthcare professionals and hospitals?
Yes. We do have an NHA hospital here in Kansas City. And one of the primary things that we do for the hospital is patient visits. And WomenHeart Champions will go in and visit with patients in the hospital who've been diagnosed with heart disease. In addition to that, though, we have partnered with all the hospitals basically in the area, and we provide them with our red bags of courage and also our heart scarves. And then when they meet with that patient on their consultation, they give them that information so they know how to reach out to us and be put in touch with us. Um, and then from there, it may just be that it, from there, then they can attend our support group meetings as well. And even some of the cardiac rehabs, the nurses, they have patients who are, um, especially for me, getting an ICD or have an ICD, or are they having to make the decision of, do I want an ICD? And they'll reach out to me and ask me to talk with their patient just to tell them a little bit about my experience and uh, what it's like living with an ICD. And so it just, for us, or it may be a SCAD patient who the hospitals are reaching out, want to talk to one of our women who is a SCAD patient. And so it's letting the hospitals, the cardiac rehab, know what kind of um, who we are and what we have within our support group, and then they will reach out to us um, to talk to their women.
So, can you give us your most important reason why you feel like the hospitals and cardiac rehabs and clinics should consider this National Hospital Alliance partnership?
For outcomes and for women who feel alone in this diagnosis to not be alone, for them to find someone else who they can talk about their journey with, who understands. I was just on a call with a patient a couple of weeks ago, and for the first time, I heard a story that was it was the same as mine. And this woman was she was in her early 40s, and it made when I told her that, it made her feel comfortable, and it made her feel like there was hope. She still had so many questions, but it was, for her, it was comfort knowing that someone else had survived this. Um, it's really about outcomes for women, knowing an education, and really them feeling like they have the support of others and that they can make it through this diagnosis.
Thank you so much, Kathy. We appreciate
Mhm.
you. That's a wonderful reason, and thank you so much. And we appreciate, obviously, you being here today. So to wrap up, if you are interested in becoming a National Hospital Alliance member for all the reasons Kathy just said, and so much more, it's very easy to get started. You contact Women Heart. I will give you my contact information for an introductory meeting, and then you can join the National Hospital Association at either the premium or associate level. So we have two different ways for you to get started with us. Then we just set up an onboarding call for your liaison and cardiovascular health leaders. And if you want more information to set up a call with us to find out more about it before you join, we're glad to do that with you too. And then we help you identify WomenHeart Champions to connect with or work with existing champions to get connected in to the National Hospital Alliance. So if you are excited about this and this sparked some interest, we'd love to have you as part of this network. It's just going to grow and grow. There is an easy way, again, it's easiest to contact me, Jody Smith, Director of Strategic Alliances. Very easy, jsmith@womenheart.org. And you can also look at the National Hospital Alliance information on our website and find out more. Thank you again for being here today. We would love to have you be part of this important initiative. Thank you.